Starting Solids segment for Prego Expo. My title is Starting Solids, 10 Expert Tips to Lower Choking Risk. But before I start, I want to give a shout out to Allie, our social community director, who's in the chat right now, and she can answer any questions that you guys might have. Feel free to type in your questions as well, and I'll try to answer them as I'm going through my presentation. And then I'll also try to have a couple minutes at the very end. And then after this, I'll run to the EzPz booth to answer any more additional questions. Hi, Brianna. Thank you so much for being here. For those of you who are new to the EzPz brand, we are a team of 6 women. So we are women-owned and operated, and we are so excited to be here to present the Starting Solids class for Prego Expo. So let's see, my screen is not moving forward. So let's see if I can figure that out. Let's see. Can you guys see my screen okay? Ellie, if you're in the chat, okay, great. So moving to the next slide, if I can get that to work, it's not working. Let's see. Are you guys seeing that slide? Great. Okay, great. So, sorry, this first time I'm actually presenting with a slideshow, so you can see me with me showing you all of the tools that I'll be talking about, plus also giving you information because you guys have asked that. So, thank you, Serenity. I appreciate that. So trying to do this, and I'm really good at feeding babies, not so great at tech. So I'm a speech language pathologist. I'm also a infant feeding and swallowing specialist. I'm also the designer and inventor for EzPz. So if you get any of our products and you look at the back of the packaging, it says designed by a pediatric feeding specialist. That's me. I'm Dawn. So if you have any questions regarding our products, I'm happy to answer those. I'm also the creator of baby-led oral care, which is the gold standard for oral care for infants under 12 months. I also just celebrated feeding my 10,000th baby. So that's been a really exciting milestone for me. Definitely have a lot of experience feeding babies, and I'm excited to be able to tell you guys a little bit about them. So we are talking about choking today, and that has been a question that came up a lot through Prego Expo chats. And so I wanted to really give you some 10 tips, because choking occurs when food or liquids or objects block the airway, and choking requires a caregiver's immediate attention. And the child is usually unable to breathe during that time. And I hate to say this statistic, but every 5 days in the United States, a child under the age of 5 dies of choking on food. And every week in the United States, a child under 3, it's the most common reason for death. So it is crazy how many children are passing away because of choking issues. At the end of the course, I'll also give you a link, or if Allie's on, Allie can give the link of, I do have a choking and prevention course. If you guys are interested in that, we'll put that in the link as well. But it is the saddest thing is seeing children that are dying of choking and parents that are scared because of choking, when it is the most preventable thing. So I'm going to give you 10 tips today to be able to help facilitate that, and make sure that you have the pre-feeding skills knowledge that you need in order to feel comfortable and safe and secure in your child's abilities. I'm going to help you with feeding practices so that you're actually knowing exactly what to do to make sure that your child is ready for that. And then I'm also going to tell you about some products that are going to help facilitate that too. So very excited to get into that. So here are some 10 expert tips, starting with tip number 1. Please wait until your baby shows all the signs of readiness before you start solids. For those of you, we had 68 people in the booth, EzPz's booth earlier, where I was talking for 3 hours in the booth. So thank you if you are one of them for sticking with me as I kept going off on feeding tangents. I was talking about the signs of readiness in there, and that we really want to be able to facilitate all the signs of readiness. And so if you have a pediatrician or a healthcare professional who's telling you to start solids at 4 months of age, that is outdated research by like 15 years. We do not start solids till baby is 6 months of age. So if your baby was premature, let's say your baby was born 4 weeks early, you're not going to start solids until your baby turns 6 months and 4 weeks. So we want to make sure that we're waiting to start solids until your baby is developmentally ready. So it's so important to be able to make sure that your baby has these signs. And we're going to go into details of these 6 signs of readiness, and that you are comfortable. When you get ready to feed your baby, you want the mindset that you are confident and you know that your baby is ready and that you know all the skills that you need to have in order to be able to facilitate that. So we want to make sure that we're waiting. So the first sign of readiness is your baby showing interest in objects or foods. I'm going to use some of the teethers that I designed to showcase this. We want your baby to be interested in objects. So if I was to lean this towards your baby's going to look at that and get really excited about it and very interested in object. And that is the first sign of readiness. I can't tell you how many babies I have gone to do feeding therapy with, and the baby is just looking around, not interested in food, not interested in objects, doesn't grab for anything. That is letting you know as a parent that your baby is not ready. So I'm seeing some questions in here. Can we wait to the first year to start with solids? No, we want to introduce solids at the 6-month mark, because if you wait to start finger foods later, it increases a child's risk of choking and it increases the severity of picky eating. We want to be able to introduce baby to solids, preferably finger food sticks of food, which we're going to go more into, because American Academy of Pediatrics, the World Health Organization, feeding specialists like myself, there's lots of research that says that if we wait till the 6-month mark and then we start to introduce those purees and finger length strips of food, babies decrease the risk of choking. And there's so much research on that now. When I started teaching baby-led weaning 15 years ago, there wasn't tons of research on it, right? It was just our own clinical observations of what babies are able to do. But now there is research that the babies that choke are the babies that have had finger foods the least often and have been the babies that have had finger foods closer to that year mark instead of closer to that 6-month mark. So it's really important to know these signs of readiness and really introduce it at the 6-month mark. So if you see number 6 on the signs of readiness is wait till your baby's at least 6 months of age. So we want to not wait till 12 months. That's a really great question. And I get that a lot. And I'm so glad that you asked that question. And that's really important because so many families here get mixed information. They'll say wait to the 12-month mark, or I've heard start solids at 4 months of age. And it's really important for us to know that the research says we're starting at 6 months of age. So we're looking for babies to show interest in objects. We're looking for babies to show interest in food. If you're eating a sandwich and your baby's like looking at you and are really interested in that, then we're checking that sign off. If your baby reaches for an object, so I put this object out and your baby reaches for it, that is another sign of readiness, because when we introduce solids and we put foods on a mat onto the high chair and baby grabs food off of that mat, we want them to be able to reach for that food. The third thing is that we want babies to be able to grasp the food. And the research shows we want the ways to be able to grasp for objects and grasp for food is a short, fat, round handle. So I designed our handles, all of our handles. Here's our teethers. Here is our toothbrush. Here is our spoon. Here is our popsicles. They all have the same handle because we need that developmental grasp, which is the palmar grasp, for babies to be able to grab a hold of that, have that be in their chunky little fist, and so that they can grab onto it, just like what's seen in the picture. So grasping objects. Again, I see a lot of families that are struggling with solids, and they're like, my baby just doesn't like the food that I make. But actually what it is that the babies haven't been able to learn how to grasp objects, so they haven't learned to be able to grasp foods. So this is a sign of readiness. We also want them to have the head control. I've seen so many babies start solids and they're sitting in the high chair and their head just kind of plumps over and they kind of do a face plant onto that. So it's really important to make sure that baby has head control. And so I'm seeing Serenity says, so my baby can sit for a few seconds, but has good head control. My pediatrician said they were good to go. I was going to wait till she could sit up on your own. What's your opinion? Yes, this is one of the number one signs of readiness. Your baby needs to be able to sit and maintain that sitting position for 10 to 15 minutes. So that is a good example of some inaccurate medical advice, because that puts your baby at high risk for choking. Your baby needs to be able to have that, maintain that sitting position in order to be able to have that stability to protect their airway. If they start to slump, if their head starts to go back, or they start to slouch over, your baby is going to have an increased choking risk. Research says baby needs to be sitting up straight. Your chin has to be slightly tucked to be able to protect their airway. So please, please, please wait. And your mommy gut's telling you, Serenity, you know it. We need to wait to start solids till babies are able to sit up correctly. So next is number 5. They're able to maintain that sitting position while chewing on objects. So I have lots of kids that are able to sit into the high chair, but as soon as we hand them an object and they start chewing on it, they start slumping over. That means baby is not ready. They need to be able to maintain that sitting position, protecting their airway in that positioning, and be able to chew on objects. And then the last sign of readiness is that your baby needs to be 6 months of age to be able to do that. And Sierra, I see you. Examples of finger foods for baby, please. I am going to get down that. I think it's slide 7 or 8. So it'll be coming up. Okay, so moving right along here. You guys are doing great. Number 2, practice baby-led oral care. So if you all are familiar with baby-led weaning, there's 2 ways to introduce solids to baby. The traditional method, or what's also called adult-led weaning, which is through purees. Another way is baby-led weaning that lets baby master everything, be able to control all the foods that go into their mouth. And so it's really important to follow baby's lead. And you can still do purees and have a baby-led approach, but we want baby to be in control. And we're going to talk a little bit more about this on the next couple of slides too. But baby-led oral care is the way that you can empower your child to have control. It is a methodology that I actually founded, and it's allowing babies to control what goes into their mouth. There is a correlation between extreme picky eaters and those children who have been forced to have oral care, whether they're being wrapped up like burritos and forced to have their gums brushed. And now more is coming out that if we don't put that trauma on children with oral care, they have a better relationship with things that go into their mouth, like food. So I designed the baby-led toothbrush. So this is a toothbrush and a sensory tongue depressor to be able to help facilitate that. And at the very end, if you stay to the end, we're giving away a set of 5 of these dual sets that has the toothbrush and tongue depressor. So it's great. Andrea says, loved watching my sister-in-law do this with my niece, and she's such a good eater. Thank you so much. I appreciate that. Yes, it's so important. Thank you. I appreciate you saying that. So let's start with the sensory tongue depressor. So the second best way to decrease choking is to practice baby-led oral care. So we want to be able to give baby control of what goes in their mouth, which is a toothbrush, a tongue depressor, a piece of food, a spoon. We want them to be able to do that. We want to encourage safe exploration. We want to be able to look in a child's mouth very easily, and we want you guys to be able to do that at home. So many parents are like, I think my child has a tongue tie. I think my child has a cleft palate. I think there's something wrong with my child's mouth, and then they have to wait to get into the pediatrician or wait to get into the dentist. I wanted to design something that parents can do in their own bathroom, in their own kitchen, in their own house, and be able to facilitate that. So we want to use a tongue depressor. This is a reusable, dishwasher safe, stainless steel with silicone overmold tongue depressor. One side has tactile bumps and the other side is smooth. And so this is going to make oral exam nice and easy. So what you do is you get your baby, get them in a nice seated position. You want to make sure that Baby's head is nice and supported. And then you're going to slide the tongue depressor in, and I'll use my mouth as an example, with the smooth side. And then you're going to flip it over to the sensory bump slide, because the sensory bumps are going to grab that tissue and make it really easy to look into the mouth. See how you can see into my whole entire mouth? So you can look to see if there's a cheek tie. You can look, take this down, see if there's a lip tie, see if there's a tongue tie. Very easily. So it's just nice and easy. So for infants, we're looking for tongue tie, cheek tie, lip tie. If there's anything wrong with the mouth. And then you're going to use this every single month. So month 1, looking in the mouth. Month 2, looking in the mouth. You want to assess your baby's oral development. So many families have never looked into their child's mouth. And I'll tell you a really quick story. I do in-home feeding therapy in Colorado, and this mom that I was going to her house, I was on the drive there, and I was going to her house, and she calls and she's like, I think my baby's choking. You have to get here. I'm like, I'm 5 minutes away. I get there, and the scene is there's blood on the high chair tray. There's blood on the baby. Mom has a set of tweezers, and she was like, I think there's chicken in the back of her mouth. And I look into the baby's mouth with my tongue depressor, and I look into the baby's mouth, and it is the uvula. Do you guys know what that is? This little hanging down, Charlie Brown thing. Mom thought that was a piece of chicken, and she was taking tweezers and trying to pull that out. It is part of the oral anatomy. So it's that little hanging, dangling thing in the back. She had never looked in her mouth before, so she just thought that was a piece of food. I want parents to feel comfortable looking into your baby's mouth so that you can assess for illness. You can assess for an emerging tooth. You can assess to see if that there is something in it stuck in the mouth. We go back to what the research says about babies choking. When we take babies out of the high chair, we should never take babies out of the high chair without looking in their oral cavity first. We want to look into the oral cavity. You can use a sensory tongue depressor, look in the oral cavity, make sure that your baby doesn't have anything in their mouth, then take them out, and then usually they go down for a nap, right? When babies choke the most is when they're being lifted out of the high chair and laid down for a nap, and that piece of food goes down and occludes their airway. So this is going to be your best friend if you are nervous about choking. Again, it's the sensory tongue depressor, so you can look for pocketing, check in the side of the mouth, check underneath the lip, check, tilt the baby's head back just a little bit. Look and see if any food is in the up here at the palate, and everything looks good. Great. You're able to move right along. If you see some food stuck in there, then you hand the baby the toothbrush, and right after meals is perfect. Just put this on, take the plate away, put the toothbrush onto the high chair tray, and baby can start brushing their own teeth, get that food dislodged. You're able to take baby out of the high chair, and you are not going to feel so nervous about that. So now let's talk about the toothbrush. So it's a baby-led toothbrush. So we have that baby-led handle. You see the baby holding onto that toothbrush in the picture and brushing her own gums. It's going to encourage safe exploration. It's going to encourage using that handle. So that's going to help promote safe feeding. So at the 3-month mark, you can start to do the toothbrush with your baby, the 4-month mark, the 5-month mark, and at 6 months, your baby's already going to know how to master this movement. So when you move on to the spoon, that looks very similar to this, your baby's already going to know what to do. So they are getting ready. Those pre-feeding movements are so important for your baby's mastery of their hand-to-mouth coordination and their breathing and their respiration, because that's how your child is going to protect their airway. So motor planning of all of these movements is so essential to decrease choking risk, because we're going to promote that palmar grasp, which is the grasp that your baby's going to have when you cut those pieces of food that are going to be about the length and thickness of an adult pinky finger, and your baby has that their chunky little hand on that piece of avocado or whatever it is. Then they've been practicing with this toothbrush for 4 or 5 months. If they start to choke, then they're going to be able to use that palmar grasp and pull that piece of food out and be able to protect their airway. So all of this is, yes, Dorothy, a progression. I'm teaching you these skills to be able to master this at 3 months, 4 months, 5 months, 6 months. So when you start solid, your baby already knows what to do, and you already will feel comfortable. You'll see your baby using the toothbrush and knowing how to be able to chew and pull it out of their mouth and decrease all that gagging. We get all of that out of the way before your baby starts solids at 6 months of age. It is a developmental approach. It is backed by research, and I'm the designer of these products, so I can answer any additional questions. And Allie is in the chat too if you have questions about this. So this is really important. It's called baby-led oral care. The baby is a part of the process. It's going to make it really easy and gentle and playful for your child. And most importantly, you're not going to have toothbrushing battles. Your baby is doing this. So it's going to make you exactly, Amy, make you feel confident and make your baby feel confident. And remember those signs of readiness? You can do all those signs of readiness with this toothbrush. Does your baby show interest in the toothbrush? Does your baby reach for the toothbrush? Does your baby grab the toothbrush? Does your baby have head control while they're using the toothbrush? Does your baby maintain that sitting position when they're doing the toothbrush? Yes, you're on your way. Good. I'm glad that you guys are all liking that. Great. Awesome. All right. Next, number 3, support oral motor development. It is really important for your baby to develop the tongue, the lips, the jaw, all of these movements so that they can protect their airway. So many babies that I work with that have had choking scares and parents knew CPR and were able to resuscitate them. What they have in common is that their muscle movements of the mouth were not strong enough to be able to start solids. So this is so important to make sure that parents know this and that you are working on those structures. I'll show you an anatomy model really quickly. So this is an anatomy model, and this is the tongue, and the tongue is attached to this structure, which is called the epiglottis, which has to move down like this to protect the airway. If the tongue isn't strong enough, this structure does not protect the airway, and your child's going to have difficulty choking. So it's really important that we have that tongue elevation, which is what I'm going to teach you here in a bit. Tongue elevation. Everybody swallow your saliva. Feel that your mouth does 2 things. You close your lips to swallow your saliva, and your tongue goes up to the roof of your mouth. So everybody do it. I'll do it too. Feel that? Put in the chat. Do you feel that? Do you feel your tongue going up? That is what we need in order to have a strong swallow. If your child starts to choke, then what they're going to do is close their lips, breathe in through their nose, push their tongue up to the roof of the mouth really, really hard, and try to swallow really hard to push that food to go down. Everybody's saying that they feel it. Yes, good, good. Your baby's tongue strength is the most important thing. But if your child is on a sippy cup and doing tongue motions like this, they're not promoting that tongue elevation. So that tongue thrust, yes, Rachel, that tongue thrust will not allow that tongue elevation to have that protection that we need to make sure that your baby's going to recover if they start to choke. So what I did was design teethers that are going to help facilitate that. So this is our loop tool. So this allows your child to chew on it, and their tongue can come up through the hole to swallow. So they're going to swallow their saliva, because I always tell families a drooling baby lets me know as a swallowing therapist that they don't have good lip closure and they don't have good tongue elevation. And that is true for if you have a toddler that drools, if you have a preschooler that drools. Your child is not doing 2 things. They don't have the lip strength and they don't have the tongue strength. So these oral development tools are bite tested for 3 months of age all the way to 3 years of age, because teething lasts that long, right? So these tools are going to help facilitate that. So these sensory bumps are going to help with that lip closure. Get your baby to close their lips around that, because we need lip closure for drinking, which is going to be up next. So watch me drink my coffee. Lip closure. If I don't have good lip closure, I'm going to drool, right? Coffee is just going to come going down my face. So This is the loop tool, and it helps with that lip closure. It helps with that tongue elevation. So if any of you have a baby and they need to have a tongue tie revision, this is usually sold in dentist's office to help facilitate that tongue elevation so that we're stretching that muscle that has just had a tongue tie release. So this is really, really important. Amanda, what age would drooling start to become a warning sign? Whenever the child is drooling. You might have a day or two of drooling, which is normal when a tooth is erupting, but any other time that is not normal. That is letting us know as therapists that the lips aren't closed and that the tongue is not elevating. So, Lee says my hubby calls it a mini tennis racket. I like that. That's funny. Okay, so that is the loop tool. Then we have the smile tool. The smile tool is working on jaw stability. Again, we have that baby led handle. The baby's little hands will fit right in here. I can chew on that. And we're working on jaw stability. I see a lot of teethers and pacifiers and little animal toys that are attached to a child's shirt, and so that they don't fall. And I understand that, and I understand why parents will do that. But what's happening is that the child is like this a lot, and they're not growing bone growth on one side of their mouth. So their jaw is starting to shift, and it's causing TMJ problems in babies. What we need is a baby-led teether that goes into the mouth straight on, works on this lip spreading and this jaw stability. We do not want babies kinked like this because their jaw doesn't grow. We want the jaw to grow together. So this, again, is based off of research. There's sensory bumps in here. There's little divots here, so you can put breast milk or formula so babies can bite and kind of suck that breast milk and formula and help with this jaw tool. Then we have the third one is the stick tool. So if you're planning on doing baby-led weaning, I really suggest that as a feeding therapist, but we're going to cut foods the length and thickness of an adult pinky finger. So that's why I designed this tool, is that we know that we need to have baby practice these movements at the 3-month mark, 4-month mark, 5-month mark. So at 6 months, when you introduce finger-shaped foods, right, that are the length and thickness of an adult pinky finger, your baby already knows what to do. So yes, Whitney, every product is so intentional. It's based on developmental research. So I appreciate that you're saying that. Thank you, Amy and Whitney, for saying that. So now your baby can chew on this, just like the baby is chewing on this teether in the picture, and he's chewing it on our gum lines. Mama, as you see your 3-month-old, 4-month-old, and 5-month-old chew on this and see that they're able to get that, you're going to feel so much more comfortable and confident giving them a stick of avocado because you already know that your baby knows how to chew it. You already know that your baby knows how to be able to master their tongue motions to be able to swallow that safely. So this is our stick tool. And all three of these tools, they come in a package like this, and it's only $17. Amazon said that parents spend over $100 on teethers within the first year of life. So I wanted to design something that was developmental. I wanted to design something that was functional to get them ready for baby-led weaning. I wanted to design something that was for 3 months of age to 3 years of age and have it be under $20. So if you forget any of the things that I just told you, all the stuff is on the back of the packaging. So makes it really easy to understand the science behind that. So I love that. So would you say that these are the only teethers baby should think? I think so. But again, you want to go with all of what your baby craves, right? So this is for the front of the mouth. This is for the sides of the mouth. This is for the back of the mouth. That's how teeth erupt. So your baby should get all of their teething essentials and their oral motor development from these three tools. Amy says, how long they could be used for? They're bite tested to 3 years of age. The kits are sold at Nordstrom's, Amazon, our website. Allie, add in if there's something else that I'm missing. I'm sure I'm missing something else. On the registries, my registry. Thank you for following me on Insta. Appreciate that, you guys. Thank you. Okay, so moving right along. So this, if your baby has this oral motor development, then and you're supporting that, right, with, even if you use different teethers, that you know what you're looking for now, so that your baby is able to have that ability, and it's going to help decrease choking risks. Number 4, soothe sore gums and increase oral awareness with popsicles. So many families that I worked with had a baby that choked. And the reason why the baby choked is because they were trying to shove things into their mouth to help with the soreness that they were feeling in the gums, or they're trying to overstuff because of that soreness in the gums. So I wanted to design something that could help decrease the baby's discomfort, help increase their nutrition, right? And be able to facilitate that in a research-based way. So the research says that if we offer babies different tastes, textures, and temperatures, it decreases the severity of picky eating. So I designed the Tiny Pops, which is basically a set that has silicone sleeve that sits into this stand. You take the wand, you fill this up with breast milk or formula for babies 4, 5, and 6 months of age. You lock this into place and put it in the freezer, and in 2 hours, you have a breast milk or formula popsicle. And you'll see that there's sensory bumps at the very tip because it's on this silicone sleeve. And your baby can put that into their mouth and chew on it just like this baby is. And that breast milk will go down into the gum line as a tooth is emerging, and breast milk will anesthetize that area. So your baby will not feel pain when they are breastfeeding. If you are formula feeding, you don't have those extra enzymes, but you do have the coldness, which is nice and cool and helps to decrease that sensitivity and that pain that your baby is feeling. And yes, Rachel, you can add fruit, you can add cooked vegetables like cooked carrots, sweet potatoes. You can put meat in there once your baby is 6 months of age. So at 4, 5, and 6 months of age, you're just doing breast milk or formula. Once your baby starts solids, then you can add solids in there. And I want to make mention that solids are purees or finger-shaped foods, any food other than breast milk or formula. So you can put meat in there. You can put bone broth in there. Allie came up with the idea of putting Pedialyte in there if your baby is sick, right? So there's so many different things. If you're afraid to introduce your baby to potentially allergenic foods, put it in the popsicle. It'll make you feel a little bit more comfortable. So teething lasts for 3 years, you guys. So we want to make sure that we give you a product that's going to help facilitate that. So this is for babies 4 months of age to 24 months. And then we have another product called the Happy Pops, which is a bigger size popsicle for 24 months up. I just recently made margarita popsicles, so they can go all the way to adults as well. Okay. Yes, you can do yogurt, Margot. Absolutely. Luis, you could do sardine popsicles. Luis and I were talking about that earlier. I do ceviche popsicles, so it doesn't sound as pleasing to us, but add a little bit of lime in there to be able to help with that. They are a great way to be able to offer fish and other potentially allergenic foods to that. So yes. All right, let's move on. So number 5, teach open cup drinking. So open cup drinking is so important for your babies to be able to master, because your babies are holding their breath. They're learning to hold their breath. So when we are drinking, and if you guys have an open cup right now, take a drink and notice what you're doing from a respiratory standpoint. You're holding your breath. And it's so important for our babies to learn how to hold their breath early on, because as they start to introduce solids, they have to learn how to hold their breath. And what happens, and I see babies choke, is because they've been on a sippy cup where you don't have to really do that. With an open cup, you have to be able to hold your breath. So being able to learn to hold their breath from an open cup is very, very important. So this is really a great option for you. This is the Tiny Cup. We've sold 5 million across the world. It is cone shaped on the inside, so it's cone shaped like this. So your child never has to tilt their head back to drink, they can do that when they're leaning forward. So if we look at sippy cups, let's see if I have a sippy cup here. Sippy cups, when you're drinking from that, you're tilting your head back. So you're opening up your airway, and that's why it's a number one cause of ear infections for children. So we never want to use a sippy cup. We never want to put our babies in a position, to tilt their head back. Because if we are tilting, going back to this anatomy chart, if we're tilting our head back, we're opening the airway. So liquids can go back in and children can choke. That's why a lot of children who drink from a sippy cup sound like a gurgly voice quality when they're talking, is because all that liquid is going down towards their lungs. So we want them to be sitting up and being able to drink. And there's developmental milestones that are associated with this. So at 4 months of age, a child should be drinking from an open cup held by a caregiver. So in this picture, you're seeing the mom is holding the cup, the baby is drinking some breast milk and formula from that, being able to take those nice sips and be able to facilitate that. So yes, I'm seeing all you guys' comments. Kelly says, my son can't figure out how to use a sippy cup. Good, get rid of it. I love it. So at 4 months of age, babies are able to drink from that. So if you are sitting your child on your lap, you can have baby leaning against you or to the side. We want to make sure that head is forward. We don't want the head back. Remember, that opens up the airway. So the head is forward, and we're offering baby those sips. So baby's leaning forward and being able to take sips from that. Then the next milestone is at 12 months of age, the baby will be able to hold onto the cup and independently drink by themselves with some spillage. The next milestone is at 24 months. So at 2 years of age, a child should be able to drink from an open cup with no spillage. So if children at 2 are spilling, then we have some issues with some fine motor development, maybe some gross motor development. So we can address that. But we want that good lip closure. We want that good hand and mouth coordination. And if we think back, we're going back to using the toothbrush at 3 months of age. We're going back to using the oral development tools at 3 months of age. The child is getting used to doing that hand and mouth coordination. So if we developmentally plan this for our children, they're able to do all of these things. They're capable of doing it. Our babies are more capable of all of these things than we give them credit for. We just need to provide them with the right tools and to give you all the right education, because your degree is not in this, right? And so it's important for us to kind of know that. Natasha says, glad to know these milestones. Sounds like I should skip the sippy cup altogether. Yes, please do. I always use the example of sippy cups and smoking, right? If you smoke every single day, it increases your risk of health issues. If you use a sippy cup every single day, it increases your child's risk of speech issues and feeding issues and picky eating issues and dental cavities and crowded teeth and a whole bunch of other things. If you smoke occasionally, it decreases that use. If you use a sippy cup on occasions, it decreases that too, right? Okay, so there is that. Our tiny cup comes singles like this, or it also comes in our first food set. So, which has the tiny cup, tiny spoons, and tiny bowl. You can get this on our website. You can use the code PREGO20 for 20% off of all of our kits. And it comes in a whole bunch of different colors too. This is the color Sage, one of my favorites. All right. Let's move on to number 6. Number 6, we want to use proper high chair positioning. So this baby is seated with his feet supported. I can't tell you, again, how many times babies choke, and they choked because their feet did not have a footrest. So if you have a high chair and your baby's feet don't fit completely flat on that high chair, on that footrest, your baby is not seated supported, and your child has a high risk of choking. If your baby's feet are dangling and not supported, your baby will have a high risk of choking. So we want to make sure that the feet are not dangling. We want to make sure that their hips, knees, ankles are at that 90-degree angle in order to be able to help protect that airway. Because what will happen if your baby's feet dangle, if they start to choke, they will lean back to try to get some positioning because they can't use their feet to push down. So they'll lean back to get some extra support for the sides of the footrest. And then, of course, they're opening up their airway, and it increases the risk of choking. Are the straps necessary? Always worried about the extra step to get them out of choking. So what I'm supposed to tell you, and what high chair companies are supposed to tell you, is that the straps need to be in there on at all times, because more kids fall out of the high chair and have a head injury and then have to see a speech pathologist like myself because of the head injury than they do choking. So yes, you're supposed to be able to do that. If you do harnesses like the Nomi, it's literally like a pinch and the straps come off. So it's if you are going to sit right next to your baby, then I always say, you don't need to have them on because you're right there. Your baby's not going to fall out of the high chair. So it's important. And 80% of the high chairs out there on the market are not safe for babies. They're good for toddlers that are a lot longer, but their feet are dangling and they don't reach that footrest. The chair here is the Nomi high chair, which is my personal high chair. It's what I use in my feeding clinic. I also love the Trip Trap high chair, and there's a couple other ones out there as well. Okay, so that is proper high chair positioning. Number 7, we're going to offer a suction bowl or plate. So this is so important. Parents love our bowls because it decreases mess, right? They love our plates because it decreases mess. So, but why I love it is because when you have a suction bowl, it suctions to the high chair tray and it keeps your baby at midline. So if you draw a line down the middle of my body, right, that is midline. That's where we want your babies. We want in between your baby's nipples to be where the bowl or the plate is. So it's really important to keep baby at midline. If you have a plastic bowl that's sliding around, or you're just putting food on the high chair tray, then your baby is moving their neck. So whenever they move their neck, it increases the risk of choking. So I like the suction bowls because it keeps your baby at midline, and you're able to be able to make sure that your baby is staying at midline. So it's really important. So the suction bowl, the tiny bowl, is 4 ounces. We want to place that as close to your baby as possible so we can get that nice chin tuck. Remember, we want to protect the airway by keeping the chin tucked down, not with the head leaning back. Then we have, this is our bowl, and then we have our mini mat. And our mini mat has a cute little smiley face, and it is 2 ounces, 2 ounces, and 4 ounces. I always tell families to put a protein in one eye, a fruit or a vegetable in the other eye, and then a carbohydrate in the mouth, because your baby needs to have most carbohydrates to be able to keep functioning. If your baby has low iron and your pediatrician says, how much iron is your baby getting? How much protein is your baby getting? And you don't know, that's why I designed these to have the ounces on here. So you can say, if you always put the protein in this eye, you can tell your pediatrician your baby eats at least 2 ounces of iron-rich foods every single day. So it's really easy for you to be able to master that. And again, this also helps with keeping your baby at midline. We also have lids for our bowl. So this is the lid for the tiny bowl. We have a lid for our mini mat, so that if your baby doesn't eat everything, you just put it back into the refrigerator, and it kind of helps to facilitate that. So the takeaway here is that it's really important for you to know that if you have that suction bowl, instead of just putting food on the tray table, and we have mats for that too. We have a tiny placemat that can go onto your high chair tray, but really this is a great to-go mat that can roll up and you can take with you to go to restaurants and stuff. It's super cute, and it helps to facilitate that. But I like the suction bowl and plate because it really keeps your baby at midline, and again, will decrease choking risk. Great. I love that you guys are all loving that. I'm going in the comments right now. Yes, they're Liz. Yes, yes, yes. Okay. Allie can put links to some of these products too, to links to the lids. Okay. All right, moving right along. And type in yes. Are you guys learning something new? Are you learning something new today? Just type in yes so I can see that as well. Okay, Number 8, use a baby-led spoon. So why do we want to use a baby-led spoon? Remember, we've been using baby-led products throughout, right? We're using a baby-led toothbrush. We're using baby-led teethers, right? We're using a baby-led popsicle. This is all babies that are able to do this themselves, right? We're helping them get that oral development. What other spoons are? These are adult-led spoons. See the difference? Here's a baby-led spoon for babies to control. Here's an adult-led spoon for us to control. If I'm feeding baby, right? Baby is just kind of sitting back, relaxing. I'm doing all the work. We need babies to lean forward. It's called a positive tilt. It's researched by Marcia and Klein. And we want babies to be leaning forward. We want them to be able to hold onto the side of the high chair, to be able to help with that positioning. We want them to get that spoon. We want them to be able to grab that spoon, pick up that spoon, and put that spoon into their mouth like the baby is doing here. It is so important for babies to be able to do that. If they're just sitting there in the high chair and we're just feeding them, they are not learning. They are not learning to protect their airway. They're not learning to be able to feed themselves. They're not able to learn about the palmar grasp. And this grasp transitions to scribbling, to writing, to literacy goals, to language goals, to social skills goals. You ever see that kiddo in preschool that's sitting in the corner because nobody wants to eat with them because they don't know how to use utensils and they're using their hands? So it's really important for the mastery of all these other skills. Feeding milestones precede speech, language, and cognition milestones. So it's really the groundwork of everything that we're trying to do, and it all starts with the spoon. So the research says short, fat, round handle. The research says we want a flat spoon bowl, and the reason why that is because we don't want to fill that up. There's lots of spoons out there that are on the market that have huge spoon bowls, and it's just too much food for babies, and then that's how they choke. A lot of babies choke more on purees than they do on stick pieces of food, because the stick pieces of food they can pull out of their mouth. With purees, they just start drowning in that. So, and that's usually what we're feeding our babies is the purees. And so we really want to be able to have a baby-led handle, support that palmar grasp. And I have sensory bumps here on the back of the spoon. And the reason why I have that, as you can see, there's sensory bumps on everything, right? To sensory bumps on the teether, sensory bumps on the toothbrush, so that babies learn that those sensory bumps is giving them that sensory input, that's where they should stop, right? There's other spoons and stuff on the market that have, like, what they say, these choking guards, but actually it increases choking, because what happens is that your baby's gag reflex is at the very tip of the tongue. What we do to move that gag reflex back is to actually stimulate a gag. So we want babies to kind of gag on that spoon, because when you transition to those stick pieces of food, they're not going to gag, they're going to chew. So, but gagging with the spoon is not fun. So I put these sensory bumps there to help give them that sensory input so that they'll know how far to be able to put that back. Your gag reflex, my gag reflex, is way back here in the back of the tongue. So it's important for us to start to move this gag reflex back. A lot of the picky eaters that I work with for feeding therapy, their gag reflex is still up here in the front. Why? Because they haven't mastered utensils. We need to be able to have utensils to be able to push that gag reflex back. It's called grading. Grading is how babies can move that back. If you're using something like this, your baby is never learning to grade. So they're going to continue to have gagging issues. So what's important is, like, if I was going to feed you, right? If I was going to scoop up some food and put it into your mouth, you don't know how far I'm going to put that spoon back, how much food I'm going to put in there, how much pressure I'm going to put on your tongue, how am I going to turn that spoon over? Am I going to pull it out? You have no idea. But if the baby is feeding themselves, then they get all that info. They get all that information. And so their gag reflex can slowly start to move back. So when your baby becomes a year old and you're giving them a whole bunch of mixed textures like cereals and salads, your baby will have the gag reflex that's back here to be able to do that. Our picky eaters that can't handle all of those textures. Like that's why they can only have cheese pizza instead of pepperoni and cheese pizza, is because their gag reflex is still at the top of their mouth because they haven't mastered that grating with utensils. So it's really important to be able to facilitate that early on with our babies, and it starts with spoons. As I said earlier today, if you were in the booth, there's only spoons in our sets, not forks in our sets for babies. So this is our baby set that has the 2 spoons, because it is not safe to give babies forks. Lots of other sets out there have forks, and I contract for the School for the Blind, and 80% of the children that are blind in one eye are blind in one eye because a caregiver gave them a fork. So we're only giving baby spoons, and then once they reach that first birthday, then we transition to our fork and spoon set. So, but with babies, we don't give forks. All right. Number 9, we are serving age-appropriate food textures and shapes. So a lot of you said it's really important to for you to know like what's the size of shape. And I get this all the time. So we know the research says the length and thickness of an adult pinky finger. So I ended up designing the first ever baby-led weaning food cutters. So the one food cutter is this, and it's the length and thickness of an adult pinky finger. And it has these ridges so that it makes that piece of food have the ridges so that the child's tongue can find it really easy now. Allie made this cute little like gelatin mold, so you can kind of see what this looks like. So it's this piece of food, right? So you're going to chop that piece of food, and it's a perfect little food shape. So on the screen, there's a food shape with tofu, which is a potentially allergenic food that we want to be able to offer to babies. So that's really important. The other food shape is a ripe mango. So you can do that, and this is really important for babies to be able to have that food so they can use that palmer grass, put that onto their mouth. And again, if they start choking, what can they do? They'll just pull that right out. So it's really important to be able to know that. So at 6 months of age, we're going to use that palmer grass to grab food. And then at the 9-month mark, that grass changes from the palmer grass to the pincer grass, which is this grass. So now we want to have foods that baby can pinch and put onto their gum line so that they can chew. And so then I designed a cookie cutter that has 4 of these shapes. So it makes 4 little pieces to do that. And on the cutters itself, it says 9 months and it says 6 months. So you'll never forget what shape it is. So these are there. And Allie, how much are these? Are these $9.99 or are they $12? I can't remember how much these are. So you can tell people in the oh, you already just sent the link. Never mind. She's on top of it. Okay. And then at 10 months of age, you're going to introduce both textures, right? And you're going to use both of these shapes till your baby is 3 years of age. So you're going to use the palmer grass shape for 6 months of age. You're going to wait to introduce the pincer grass shapes until 9 months of age. And then around 10 months, you're going to start to do both of them. So really great to be able to have those food cutters. These are the food cutters that are first tool of its kind in the world, and they eliminate the guesswork for baby-led weaning food prep. So if you guys are wanting to do baby-led weaning, this is perfect. You just need to make sure that everything is soft, right? So we can do soft roasted chicken, you can do sweet potatoes, you can do fruits, you can do fish, you can do sardines, right? This is all important. Emily's saying, this is the first time hearing all this info. Have you written a book or can you share what you learned? Yes, I have a book that's going to be coming out soon. And so if you follow me on social at Miss Donna SLP, it's pinned at the top. I can send you links for that. The discount code doesn't work on the website. Allie, can you check on that? Prego 20 is the code. We will work on that. And I also have other virtual classes here that I do for Prego Expo, but also on the sides too. So if you follow us on Instagram, you can get that. And please follow Prego Expo on Instagram too. They are a wealth of information. So if you're not following them already, you need to be doing that as well. Okay, number 10. Educate others about preparing for starting solids. Everything that I just told you is what you can do to prepare to start solids, what you can do to decrease choking risk. Please tell other people about it. Share Prego Expo's platform, my platform, EzPz's platform, so other people can know about this. I also have a choking and prevention response course, and there's a link for that. It's go.missdonnaslp.com/choking course. You can use the code DAWN for 10% off. I also want to encourage you that if starting solids isn't really going well at the 7-month mark, so giving you 4 weeks to be able to do it, please reach out to a speech language pathologist or occupational therapist. A registered dietitian is not the medical professional you should go to for starting solids. If you're having feeding issues, they are the medical professional to go to select foods that your baby should be using. But a speech language pathologist or occupational therapist is the one that would actually help with feeding. And if you are needing some parent coaching for feeding, if you're having some difficulties with feeding your baby, I also do one-on-one parent coaching, and they're all virtual. And so you can reach out to me on Instagram as well if you're really getting stuck, and I'm happy to do that. We're going to go into a giveaway. I'm going to answer, I have like 5 minutes to answer questions, but I want to show you guys a sneak peek. Please do not do any screenshots of this because I got approval from my boss, Lindsay, to show you this. All the things that I just told you, we are launching in like 2 weeks, 3 weeks, Ellie, our Prepare for Starting Solids kit. So it'll be on our website. This is kit 1. There's going to be 4 kits, but wait till you see this. So has all this information. Remember, you guys were just asking me all this stuff that you want. It's all here. So here's our scrappy little team, all the information that you need to be able to start solids. I also have a signs of readiness checklist. So you can stick this on your refrigerator and check off all of these marks off here. And then kit 2 will have all of our food cutters, and we've got another new product that's launching soon that I can't wait to show you. And then inside, wait, there's more. Look at this. We have the sensory tongue depressor, the toothbrush, the oral development tools. Then you take off this little section here, and then we have the tiny pops. So all the tools that you need. What a nice gift this is to get for your baby. So let's get this party started. So this is great. So kit 1, sneak peek. This is launching in a couple weeks. And it's, look how small this is, right? So it's everything that you need, and everything that a friend might need if you are worried about choking as well. All right. So, oh, good. I'm glad you guys all love it. Okay, so we're going to do a giveaway. So Ellie's been marking down people. We're going to have 5 winners that win a toothbrush and tongue depressor set in the color pewter. That'll be going. So she's been picking people. She's going to put that in the chat here any second. And again, if you want more information, you can follow us on Instagram, and we want to make sure that I answer any questions. So I'm going to go back through. I saw a couple questions here. What do you put into the tiny cup? Okay, when you're offering the tiny cup to your baby, you want to put breast milk or formula. You can put purees, smoothies once your baby is over 6 months of age to be able to facilitate that. A lot of people like being able to put leftover food pouches in there as well. Anything that your family is eating. You can put soups, hot teas like chamomile to help your baby go to sleep. All that can go into the cup. So you can do that. Another question, my baby just got their front tooth. Which oral development tool would you use? So what I do is I offer all 3. I'll put all 3 in front of baby. Like if baby's in tummy time or if baby's sitting in the high chair, I'll put all 3 of them down and see which one baby chooses. I designed this one for the front of the mouth, but sometimes when those first teeth are coming in, babies are chewing on this. So it all depends on your baby and their sensory needs and what they want to do. Remember, if we're doing baby-led play, if we're doing baby-led oral care, then we're just allowing baby to fulfill that, right? So okay, I'm over time. I got to go. I'm so sorry. Okay, yes, I'm going to the booth. Thank you. Bye, everyone.